Hello, this is Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is avoiding surgery for degenerative disc disease. The normal intervertebral disc is composed of 80% water along with 20% collagens and proteins. The best analogy is to that of a jelly donut. I don't mean to make you hungry, but that's the best analogy. The harder part is the annulus fibrosus. The inner jelly is the nucleus pulposus. No nerve endings inside, okay? Outer layer does have nerve endings and it can feel pain. The disc, as 80% water, is an excellent shock absorber. When we run, bend, twist, all of that pushes water out and then it gets sucked right back in. When you get degenerative disc disease, basically what's happening is the disc starts to lose water, almost like a prune. Height loss starts to occur and pain may occur from resulting tears and cracks in the annulus with the degeneration. Now, 40% of the time, a person's back pain is coming from the intervertebral disc. This can lead to inflammation and irritate adjacent nerve roots, so it can also cause sciatica. See, healthy disc here, decompressed disc from loss of height due to the water coming out. Get some bulging there, okay? Now, degenerative disc disease may lead to daily disabling pain, or it may be completely asymptomatic. There was a study done years ago showing that between the ages of 20 and 50, on an MRI, 35% of those show some degeneration, but they have no pain whatsoever. So just because you see it on imaging studies doesn't mean a person's going to be in pain. So treatment options include medications such as over-the-counter anti-inflammatories and Tylenol, acute narcotics for short-term exacerbations. Long-term narcotics for degenerative disc disease is a little bit tricky, not always the best option. Topical prescription pain creams can be very helpful, along with muscle relaxers and physical therapy. Chiropractic treatment can help. TENS units, which are about the size of an iPod, they have these foam pads that go on your skin and emit slight electrical impulses. Spinal decompression therapy, as you see here, is computerized intermittent traction that can be very beneficial in over 85% of patients. And acupuncture has some good research behind it. Interventional treatments for degenerative disc disease can consist of trigger point injections, which are subcutaneous injections and are great for muscle spasms, intradiscal injections, which, when done with steroid, have been shown to provide months on average of pain relief. There can also be some regenerative medicine injections we'll talk about in a moment. When you have a problem in the disc, sometimes what happens is it shifts abnormal stresses to the facet joints in the back of the spine, and it can lead to facet arthritis and pain. That's why medial branch block or facet injection can be very helpful for treating degenerative disc disease. If those work and then wear off, a radiofrequency ablation can be very beneficial and can provide pain relief for up to 18 months. Very amazing outcomes with that. Epidural injections can be helpful because you can get inflammation and irritation of the adjacent nerve roots. IDAT has not done much anymore. It's intradiscal electrothermal treatment. The reason is because it didn't work so great, so insurance companies stopped paying for it. The mild procedure is minimally invasive lumbar decompression, and that actually works pretty well. Here's a radiofrequency ablation. You can see facet joint, facet joint, facet joint, facet joint. These are tiny little nerve endings providing sensation to the joint called the medial branches. So radiofrequency ablation will deaden those and can provide pain relief, like I said, up to 18 months. You can do multiple joints at one time too. Regenerative medicine now consists of platelet-rich plasma therapy along with stem cell injections. There are various types of stem cell injections. It can include bone marrow or fat-derived aspiration. You can also do amniotic-derived, which is coming on strong as far as popularity. So any one of those is an option and is really on the cutting edge of what treatment can consist of. Comparison of long-term outcome for patients with back pain and a discogram that was positive did not demonstrate a significant difference in outcome measures of pain, health status, satisfaction, disability based on whether the patient elected for a fusion or non-operative treatment. 75% of the time, patients are able to achieve a satisfactory level of baseline pain with degenerative disc disease and avoid surgery. The top non-operative pain management in the Dallas-Fort Worth area is through the TEX-PAIN Network. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.